Hello, everyone, and welcome to Arthritis at Home. My name is Ellen, and I'm the programs coordinator. Today, I'm joined by Dr. Sylvain Bourgoin, who is a researcher at the Research Center of Quebec as a part of Laval University, as well as professor in the Department of Microbiologie-Infectiology and Immunology as a part of the Faculty of Medicine at Laval University. Dr. Bourgoin recently, as well as his team, were successful in obtaining the strategic operating grant from Arthritis Society for your project titled Understanding Inflammatory Arthritis on the Path to Tailored Treatment. So, Dr. Bourgoin, we are so grateful to be having you on the program today.
So, thank you for inviting me. So, I will just a short bio of my career. So I was trained I got my PhD in France, University Paris 11, and I moved to Canada for postdoctoral training at Laval University, and also in Toronto for 2 years. So, and I came back as a professor at Laval University, and from the beginning of my career, I was interested in lipid mediators of inflammation, and there are many proteins in our body that can produce lipid mediators, and they are involved in many diseases, including, rheumatoid arthritis, lupus, psoriatic arthritis. So my ongoing work has been always on these lipids, and more recently, I was focusing on patients that having lupus and early arthritis, and we identified a protein, something in the blood that is a new, it's not a new, but it's uncharacterized phospholipases, and we don't know what is the function in rheumatoid diseases. And we know that this protein is, the level of this protein is a bit elevated in patients having lupus and rheumatoid arthritis, and we are trying to understand what is the function of this protein. It could be a marker, specific marker, blood marker, or it could be a protein that is involved in inflammation. And the problem with patients that have arthritis, lupus, rheumatoid arthritis, there are a lot of comorbidities that includes, atherosclerosis, blood clotting. So we and people have to deal with these comorbidities. So we think that some of these inflammation in systemic inflammation could be a way also to increase the well-being of the patient having arthritis, and also decrease the risk of comorbidities. So why this protein is important? We think that this protein is very important to shape the immune systems. So the immune system is, there are cells in the body that control what we call the innate and adaptive immune systems, and this is very important for the inflammatory reaction. So we think that these proteins control the inflammation, and it could be a way to, on first, a way to decrease inflammation, and on the other hand, and to decrease some comorbidities that are linked to cardiovascular diseases, so atherosclerosis and thrombosis. So it's why we were interested in that protein.
Yeah.
So what is interesting also is that this protein could be targeted. It's a protein. It has activities. It produces lipid mediators that can regulate the function of T cells, macrophages, neutrophils, and all these cells are involved in the inflammatory reaction in lupus, in rheumatoid arthritis, and this could be a way to decrease inflammation. And of course, we want address the cause of lupus or rheumatoid arthritis, but we can decrease inflammation, systemic inflammation, and then increase the quality of life of the patient. That's the goal. So we know that for treatment of lupus or rheumatoid arthritis, there are many options. There are non-steroid anti-inflammatory drugs. There are corticosteroid, biologic, but they all have different side effects, and many side effects are on the stomach. You know, they can induce stomach pain, some gastrointestinal bleeding. Some of the drugs have some liver cytotoxicity or kidney cytotoxicity. So it's always, you have to deal with this side effect of the drug. So if we could have some drugs that have less side effects, I think it will be better for the patient.
Absolutely, Dr. Bourgoin. I think your research, right, is just so cutting edge. And as you had explained to us, originally where your area of expertise is looking at what we call lipid mediators. For our audience, lipids are another word for fat. Mediators are basically a molecule that acts as a signal. Can we say that? Signaling molecule. They're fats in our body that acts as a signaling molecule. But now you've, through your research, discovered this protein. Proteins also can act as signal molecules. And these signal molecules are and can interrupt pathways that lead to inflammation in our bodies. And what you're doing, your research, is looking at how you can change the effect of this protein that can perhaps turn off and on different pathways to kind of what we in research called modulate, but think of that as turn on and off, right? The inflammation.
Yeah. And all these lipid area is very complicated because you have lipids that are pro-inflammatory, and we have other lipids that can promote the resolution of inflammation. So you have to be very careful about what lipids you are looking at and what lipid pathway you are targeting in order to decrease inflammation and hopefully to increase the resolution of inflammation processes. So that's the goal, and it's as I said, it's very complicated because there are hundreds and hundreds of lipids that could shape or modulate the immune systems.
Yeah, it's so complicated, and really, like you said, it's not as simple as I'm going to change X, it's going to lead to Y. In the body, there's, like you said, thousands of pathways. So the fact that you are able to even discover, right? Now you are looking at it in an isolated fashion. And Dr. Bourgoin, can I ask you very kindly, what tools, how are you looking at these? How are you looking at these tiny little proteins and these tiny little lipids? What kind of technology do you use?
So approaches or techniques we're using in the lab, it's to do an ELISA to monitor the levels of this protein. Then to understand what is the function of this protein, we genetically modified a mouse. So we have now a mouse that can be used to understand what is the function of the protein on the immune system. Of course, a mouse is not a human, but we can understand from mice that are knocked out for this protein what is the function of the immune system. So we can induce arthritis in mice and see whether or not the mice are less or more sick. And the first experiment we did with these mice is to use a system which called Manan-induced psoriatic arthritis. So the mice gets inflammation in the joint, and also there is a skin inflammation. And what we found that there is a decrease in the symptoms, decrease in arthritis severity, suggesting that the protein is in some way is involved in the disease pathogenesis. So now what we are understanding, say, what is the function of this protein? Does it function on T cells? Does it impact the macrophages that is involved in inflammation? So that's the question. And the other point that we want to know, it's a protein that is inside the cells, but also secreted by the cells when they are activated. So we try to understand, well, what is the function of the protein inside the cells, but what is the function of the protein after being secreted? So, and we know that when it's secreted, which is in our extracellular fluids, then it can produce bioactive lipids that will activate the T cells or modulate the function of T cell and macrophages. So it's all this cascade we wish to understand. So fortunately, there's little tools to monitor the lipids that are produced by these phospholipases. So we try to develop a way to quantitate these lipids in the blood, in the plasma, but actually there is no ideal techniques to monitor these lipids. But we can assess the function on T cells, on macrophages, and all other immune cells.
Wow, like that is how you advance your research is.
Yeah.
The fact that we can't even measure, like we don't have a blood, like we can't even measure it in our serum blood. That's incredible, right? When you think of how advanced, right?
Yeah. So
thick as well.
Yeah, and what was interesting with that project, because we were starting with plasma from a sick patient from having lupus and early arthritis. Then we are moving to mouse models to understand what is the function of the protein, and maybe in a few years we'll come back to humans and maybe try to develop molecules that inhibit this protein, and whether or not there will be goods for patients for treatment of lupus or rheumatoid arthritis. We'll see. We don't have clue any, but from our early experiment, early data, preliminary data, we know that we can certainly decrease inflammation. So it's going in the right way, in the right direction.
Wow, you know, it's when we think about research and how we get medications, right? We just have them. We go to their doctor, we get them. But the time, the effort, the science used to develop medications, right? Like we start in a petri dish and then we move to mice. Once we validate mice, and then we do these kind of preclinical trials in humans, and then we do a type 2 and a type 3, and it's truly, you know, I as a translational researcher, I just want to hats off and give all the credit to the basic scientists, right? They're the ones really, without them, it's like I can't do my job. So I, you know, do applaud you and your team for not only like finding that phospholipase molecule, but now being able to target and to turn it off, and hopefully, like you said, it will be able to reduce inflammation in patients, right?
Yeah, but doing, you know, basic research is very easy, but what it's become complicated is to translate this in a therapy for patients, because there are many steps that you should follow to, well, you have to develop a molecule. So this molecule should not have toxic or should have no toxicity, no side effect, and then you test it in animal models. When you go humans, phase 1, phase 2, 3, and 4 clinical research. So it's a long way, and it took years and years to bring a new treatment on the market, and that will be available for patients.
But if there wasn't people like you driving this research, then we wouldn't have had, you know, even better. Like, yes, it takes a long time, but I think, you know, like you said, there's a reason why it takes a long time.
Yeah.
We have to ensure that it's safe. And
that's right.
Right, the processes are there, the regulations are there for a reason, right? To protect people. We are so excited for your research, and you know, we wish you truly all the best luck.
Thank you. I would have to thank the Arthritis Society for giving his support, and I know there's a lot of researchers in arthritis in Quebec City that got support from the Arthritis Society. So we thank you for this support, and it's very important. And we also thank all the people that give money to the Arthritis Society, because without these people, we would not be able to do our research and make, you know, increase knowledge, increase, you know, a treatment option for the patient.
That's so well said. So, you know, huge thank you to everyone who contributes to giving back to the research that at any level, right? Whether that's basic or clinical or translational. And then thank you to the Arthritis Society, as I now get to interview someone who is truly a leader in this field. So huge thank you to everyone, and thank you to Dr. Bourgoin. Can you pronounce your last name for me one more time?
Bourgoin, Dr. Bourgoin.
Dr. Bourgoin, for your time and your expertise, and I will practice my French for the next time I get to interview you.
Okay, thank you.
Thank you so much. Take care, everyone. Thank you for joining us.
Bye-bye.
Bye.